will be talking to you all today, really focusing on the genitourinary syndrome of menopause. I know in the program it says female sexual health, but they kind of go together, right? And I only have 15 minutes to tell you about this, or I could talk about female sexual health for probably like 15 days. So I'm also a certified sex counselor, an educator, as well as a certified menopause practitioner, an ISWISH fellow, and then HAES, I'm a health at every size provider as well, which is really helpful for a lot of my folks, and that we don't take weight always into that consideration of like where the problem is coming from and what's going on. These are my pretty robust objectives. I'll let you all kind of just look over those, but the main focus again today is that we're just going to be talking about genitourinary syndrome, menopause, and why is this important for urology providers? Okay, what is the difference? So we have genitourinary syndrome of menopause and we have vulvovaginal atrophy. Well, in 2014, the North American Menopause Society and ISWISH, which is the International Society for the Study of Women's Sexual Health, came together and said, VVA is just not cutting it, right? It's a component of this larger syndrome that we really need to have more conversation around. So what they did is they came up with the terminology of genitourinary syndrome of menopause, and that this really is describing the signs and the symptoms of hormone deficiency that is happening in the female urogenital tract. And that is including the vagina, the vulva, the vestibule, the clitoris, the bladder, the trigone area, the urethra, and those pelvic floor musculoskeletal structures as well. So what are we looking at? What are these patients coming to talk to us about? I have it broken up into kind of 3 different sections here. So one of it is going to be the genital symptoms. They're going to be talking about just feels dry, right? They may have a lot of burning, a lot of irritation in the genital area. They have itching, right, from this loss of hormonal deficiency that's happened. And it's not a yeast infection, right?